I think you know that rib joint with vertebral column posteriorly and with sternum anteriorly. With vertebral column. It is two joints. First joint, it is joint of the head of the rib. Here. Articulatio capitis costa. And another joint between tubercle of the rib and transverse process. It is articulatio costa transversalia. First joint, joint of the head of the rib. Tell me please, it is simple or compound?
Compound.
Look here. First articular surface, it is head of the rib. Second articular surface, it is half part of fossa on one vertebra, and another articular surface, another half on another vertebra. 1, 2, 3 articular surfaces. That is why it is compound. But, what but? But first rib,
Yes,
first rib, joint with first vertebra, one rib with one vertebra. It is simple. And what else?
11th.
And 11th and 12th thoracic vertebra has complete fossa and joint with corresponding ribs. They are also simple. Three joints, first, 11th and 12th are simple. All other joints are compound. Next. Head of the rib has spheroid shape. That is why it is spheroid joint. Spheroid joint, sorry. Spheroid joint, it can have how many axes of movement? 3. But these spheroid joints combined together with joint between transverse process and tubercle. And this joint is cylindrical and has only one axis. That is why together in all of these joints possible only one axis of movement. It is frontal axis, and we can pull ribs upward in time of inspiration, yes, and downward in time of expiration. Once again, it is simple or compound. It is spheroid, uniaxial, and combined joint. It is joint of the head of the rib. Inside of this joint present ligament. This ligament starts from crista capitis costa and go to discus intervertebralis. And name of this ligament, ligamentum capitis costa intra-articulare. Inside of joint, intra-articulare. And another ligament outside of joints, it is ligamentum capitis costa radiatum. Another joint between tubercle and transverse process, articulatio costa transversalia. It is simple, cylindrical, uniaxial, combined joint. And it is present ligament, ligamentum costa transversalia. Next, joint between ribs and sternum. You know that how many ribs attach to the sternum? 7 upper ribs. They are true ribs or costa vera. First rib, joint with the sternum with the help of cartilage. That is chondrosis sternocostalis. First rib. All another 6 ribs joint with the sternum with the help of joints. Articulatio sternocostalis. Articulatio sternocostalis. It is simple joint, 2 articular surfaces, plain, uniaxial, and combined. I think it is clear for you that impossible to make movement here without movement here. Clear? All of these joints move together, And if they are combined together, all of them has one axis of movement, uniaxial joint. In this joint present ligamentum sternocostale radiata. Ligamenta sternocostale radiata. It starts from rib and go to sternum, and all of these ligaments continue on anterior surface of the sternum and formed here membrane. And this name of this membrane, membrana sterni. Membrana sterni. Next, 8th, 9th, and 10th ribs in front, joined with upper ribs with the help of syndesmosis. Anterior ends of these ribs joined with upper ribs with the help of syndesmosis. And between cartilages, here it is cartilage of the 7th and cartilage of the 8th rib, here it is. Between these cartilages present joint articulatio interhondralis. Cartilage, it is chondros. Articulatio interhondralis. Plain, uniaxial, combined joint. And last two ribs floating, they are free. They are not joined in front with ribs or with the sternum. Next, you read yourself thoracic cage as a whole. Necessary to know apertura thoracis superior, inferior, angulus infrasternalis, intercostal spaces, and different shapes or different types of thoracic cage. Plain thoracic cage as a barrel, conical shape of thoracic cage in different types of constitution. And next, articulations between sternum and clavicle. Sternum joined with the clavicle with the help of joint articulatio sterna clavicularis. It is incisura clavicularis and extremitas sternalis. It is simple joint. It has saddle shape. If it is saddle, how many axes of movement in saddle joint? Do you remember? Saddle, the same like ellipsoid and condyloid, has two biaxial. But inside of this joint, present cartilage, and this cartilage divide cavities of this joint into two halves. What is the name of this joint? If it has discus or meaning complex joint, it is complex joint, and this cartilage increase number of axes. Do you remember where the same in temporomandibular joint, the same situation? Well, that is why it is saddle but multi-axial and combined, because movement in this joint performed together with acromioclavicular joint. Two joints combined together. And again, simple, saddle shape, multi-axial, complex, and combined joint. Which movements possible here? First movement is surround, what is this axis? Vertical. Surround vertical axis, we can move clavicle forward and backward. It's possible, forward and backward. Another axis, what is sagittal? Upward and downward. Possible? And last movement, it is rotation of the clavicle surround its own axis. Rotation. If I pull my hand backward, this movement, in this case, clavicle, small rotation surround axis of clavicle. Ligaments. Between sternum and clavicle, present two ligaments, one of them in front, ligamentum sternoclaviculare anterior, and behind ligamentum sternoclaviculare posterior. Below of clavicle, here it is present first rib, and between first rib and clavicle, present ligament, ligamentum costa claviculare. It is ligamentum costa claviculare. And last ligament, it is one clavicle, here another clavicle. And between two clavicles, above of jugular notch, present ligamentum interclaviculare. And again, ligamentum sternoclaviculare anterior, ligamentum sternoclaviculare posterior, ligamentum costa claviculare, and ligamentum interclaviculare. And last joint, it is joint between clavicle and scapula. Acromioclavicular joint. Articulatio acromioclavicularis. Here it is. This joint is simple, ellipsoid, complex. It also has intra-articular disc, multi-axial, and combined. Movements the same like here, upward, downward, forward, backward, and rotation. And ligaments. In this joint, first ligament between acromion and clavicle, ligamentum acromioclavicularis. Another ligament between coracoid process and tuberculum canaidum, ligamentum coracoclaviculare. Put here preparates, or you not receive preparates. You not receive preparates, only bones. Yeah. Next time, ask in laboratory preparates, ligaments, joints necessary to receive, and ask me in beginning of our classes. I show you on preparates own ligaments of the scapula. Scapula has own ligaments. One ligament above of incisura scapulae, here it is ligamentum transversum scapulae superior. Another ligament is between spina scapulae and cavitas glenoidalis, from here to here, above of neck of the scapula, ligamentum transversum scapulae inferior. And last ligament between coracoid process and acromion, above of shoulder joint, here it is ligamentum coraca acromiale. That is all.